It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is hospice, and joining me is Kathleen LaPorte with Vitas Healthcare. Welcome, Kathleen.
Thank you.
It's good to have you back.
Well, it's good to be here.
Thank you. Folks, I want to explain to you, today it might be just a little bit difficult, some of the content we're going to talk about, because I'm going to ask Kathleen to basically explain what hospice is. And I've got a series of questions that we really want her to answer. So I'm going to ask some specific questions, which deviates a little bit from the way I normally do a TV show. But I think it'll work out. So, because she's a nurse and she knows what she's talking about. Yeah. So let's help our viewers understand what hospice is, Kathleen. A lot of people just do not understand.
A lot of people don't understand hospice. They think it's a place. They think that there is somewhere that they're going to go, and they don't understand that hospice is a benefit that they're entitled to. Hospice's focus is caring for patients with a life-limiting illness with a life expectancy of 6 months or less. And in that care, we provide care wherever that patient may be. And our focus is really working on symptom management and supporting both the patient and family through this process. We have a wide variety of disciplines that support caring for that patient. We are probably the truest form of interdisciplinary care, having nurses, social workers, chaplains, and a whole team of professionals led by a physician to provide care to our patients and families wherever they may be.
Okay. Before I even ask a question of Kathleen, viewers, I'm going to make a comment about Vitas Hospice and what other hospices do also. But the one thing that I think is sort of second nature to you all, Kathleen, but when you talk about pain management, death management, making a person comfortable, family comfortable, I think it's important for viewers to understand that the doctors and nurses have a whole array of pain medication and pain management medication available for end-of-life situations that generally may not be used in everyday treatment. Can you talk about that just a little bit? Because I think it's really important for people to understand.
Well, hospice's focus is really on quality of life. And, pain management that you speak of is a lot of things. There's different types of pain. There's symptom management, and there are certain medications that our physicians who are board certified in hospice and palliative care really know to order for patients to manage their symptoms. There is emotional pain where patients are, doing a life review, and that our social workers and our chaplains are there to support as well. So pain is more than just physical, but our doctors are board certified and they are experts in managing any type of pain.
Okay, let's talk about a pain that maybe not call it pain, but to me it's a pain. It's something called fear.
For most people coming onto hospice, it's the fear of the unknown. And our role is really to educate the patient and the family, as to what to expect with their disease process. It's really teaching them what is going on with them, taking it from the doctor diagnosis. A lot of people think that when they come onto hospice, there's nothing more that can be done. But there really is so much more that can be done. Explaining to families how to care for their loved one, explaining to patients what to expect as their disease process progresses. So those are the types of things that a hospice can support as well. It's that teaching and education. And I've been doing hospice since 1986. And for most people, it's the fear of the unknown. What to expect as their loved one gets worse.
Yeah. But I think something that hospice brings to the equation, when I use that word fear, for some reason, some people can accept the fact that they're dying. Other people cannot accept the fact that they're dying. But good hospice management helps that person lessen the fear attached to the dying process. Am I right or not?
That is correct. You know, if you're for Vitas, we've done this for such a long time, since 1978. And for us, it's meeting every patient and family where they are in their acceptance. You know, you don't have to, you know, we don't talk every day about death and dying, but we're there to support each patient and family where they are. If we're doing our job well, we're going to support patients and families through that whole process, from admission to the program and hopefully having a peaceful death at the end of life.
But how can families and caregivers understand when they can start to benefit from the hospice services, Kathleen?
Well, typically most hospices, this is a nationwide statistics, most people come on hospice and they only live less than a month or 21 days. So the sooner that they access hospice, the better off they are. You know, every individual can first start by all of us having that conversations with our families as to what our wishes are. What do we want to happen to us at the end of life? Do we have advanced directives? Does our family know what our wishes are? Do we want to be placed on life support? You know, at one point, do we want to just be comfortable and enjoy our quality of life? So those are some of the things that hospice can help you sort out and support the family in making those decisions. Hospice care, rather than waiting to that 21 days, the sooner that a patient comes on to hospice, the better off we're able to support them through that process. So earlier is better.
Earlier is better.
Right. Doesn't mean we're not going to treat patients. You know, we're not aggressive. We're not looking for a cure, but we are looking to support patients and families through symptoms so that they have the best quality of life, if that's possible.
I know that generally speaking, a doctor would or should indicate to the family it's time to think about hospice. But do you get called by the doctors to contact the family? Or how exactly does the contact process work?
Anyone can refer a patient to hospice.
Anyone?
Anyone can refer. If it's on any family member, anybody can call us for information about hospice. And we do something called an information visit. So we'll give you information. But in order to become a hospice patient, a physician has to say that, yes, hospice is appropriate for this patient. And so we'll call the physician for you. We'll make that contact, or we'll encourage you to speak to your physician to see if hospice is an option for you.
So let's say a family member, and I'm thinking of some families I've dealt with that some of the family members can accept the fact that the mother's dying, some cannot accept the fact that the mother's dying. Let's say the family member that accepts the fact that the mother is dying contacts you. Then what can the entire family then expect you as a potential hospice provider to do? What we will do
is we'll explain what our services are to the family. We will encourage either them to call the physician or we will call the physician. We usually come out as soon as we get that physician order, and then we will explain our services in detail, and we'll tailor our plan of care to meet what the patient and family wants. And that's how we start hospice care and begin hospice care. An admission nurse will come out, they'll speak to the family, they'll determine together with the family and the physician and our team physician what the plan of care will be for that patient. So,
but when they talk to you, I don't think there's any charge for hospice care, is there?
All hospices are paid the same. For patients that have Medicare pays hospice care at 100%. Medicaid pays hospice care at 100% as well. And most insurances do pay for hospice care. But we care for patients regardless of their ability to pay. But hospice is a benefit under Medicare and Medicaid that people are entitled to. And all hospices are paid exactly the same.
Have you ever had a patient that you didn't get paid for?
Oh, sure. We do quite a bit of charity care. I think as a company nationwide, at one point, the last count we did was about $10 million in charity care, plus how we support the community. So we do provide care for patients that, regardless of their ability to get paid.
I'm in this day and age, I can't imagine somebody not qualifying for Medicare or some Medicaid benefit. I just can't imagine that.
Well, there's lots of people that, live in this country that maybe have come from other places. There's some people that haven't worked, on the books or things like that.
Yeah, I guess we don't think about that.
We don't think about those people, but we do. We get a lot of referrals through the community of patients that have no resources, but we're not going to treat them any differently than the person that has insurance, because they deserve and they need that support at the end of life.
I've dealt with a number of hospice organizations throughout my Navy career, and especially when I had my job as commanding officer of the Navy home, we had a lot of different hospice organizations. And you're right, all hospice organizations treat patients the same. Mm-hmm. And I guess I've been fortunate, but I've never seen a bad hospice organization. Mm-hmm. I don't know how other to put it in that.
Right.
It's got to be one of the most difficult jobs that I imagine that you could encounter. And as a nurse, have you ever encountered anything more difficult than your work as hospice?
Well, I don't see hospice care as difficult. I feel like it's been a wonderful journey for me to be able to meet so many people and be a part of their lives. But hospice is certainly a benefit to people, and we make a difference. One of the things about hospice care, and you stress that we care for patients regardless of their ability to pay, is that we do really support not only the patient during that when we're caring for them, but we provide bereavement support for the family for up to 13 months at the end of life. But all hospices are similar. All hospices provide care. All hospices are reimbursed. When you're making a decision about hospice care, you should look at and focus on the quality of care that's provided. And one of the things that I'm proud to say for Vitas, that since we've been in existence from 2002, that we've grown because of word of mouth and the quality of care that we provide. We've come to be known as a good quality organization providing care to the residents of Brevard. We started in 2002 with no patients, and we care for nearly 600 patients on a daily basis. So,
let's say you encounter a difficult patient or a difficult family. Mm-hmm. Whose job does it then become to try to help the family understand what is happening or what's not happening? The family has all kinds of ideas as to what hospice should do, what they can't do. Mm-hmm. What are some of the reasonable expectations that families should expect from the provision of service, maybe the type of services that you're doing? What are some of the expectations?
Well, certainly all patients come with their own individual challenges, and we don't like to think of anybody as a difficult patient. Think of yourself. If you were losing a loved one, how you would feel. You're going to be very emotional. And I know when I've lost loved ones, I've been very emotional and probably demanding. Hospice, one of the things that Vitas does well is we tailor our plan of care to meet the needs of the patient and family. Maybe they don't accept hospice in the beginning, but that's what our team's job is to support the patient and family, the nurse, the social worker, the chaplain, the physician, all educating the patient and family as to what to expect. And usually most families do come around. Actually, I was, right before I came here, I was talking to a family that was very, very they were separated, they weren't very close, and they lost their brother, and they were talking about the experience that they had with hospice and what a difference it made and how it brought them all together, and that they weren't able to really accept that their loved one was dying, but they had the most beautiful experience at the end of life. So that was just such a heartwarming thing to see that we were able to bring this family together and that they were able to be at their loved one's side. So we teach, we educate, we support.
Our conversation is all pretty much decided. I'm asking you what the family should expect from your professional providers. But what should you as a professional provider expect from the family? What should the family be expected to do in all this?
Right.
I think it's important.
Right. We are a service that we provide to patients and families. They would expect that there's a nurse that's going to visit them on a regular basis, that there's going to be a chaplain, that there's going to be home health aides that are going to help with physical care, that we're going to have volunteers, that we're going to have a whole team that's going to support them. That's what they should expect. They should expect that we're going to be there for them 24 hours a day, 7 days a week, regardless of the time that they call. They should expect that they're going to receive different levels of care. We're going to care for that patient, whether they're at home, in the nursing home. We're going to care for that patient if they need routine home care. We're going to provide our visiting nurses on a regular basis. If they need a higher level of care, we may care for that patient in what we call continuous care, where we put one-on-one nursing in the home to support the family through a crisis situation. That if they need more than that they can have general inpatient care in our inpatient facility, and that we also provide respite for caregivers that are stressed. Those are the things that most hospices provide. And when you're choosing a hospice, you should, really focus on the quality of care that they provide during that process.
But what do you hospice providers expect from the family? What should the family do? And what are they?
Well, the family are the caregivers. When we're here to teach and educate them how to care for their loved one. We're a support system for them. We're not taking over the care of their loved one. We're going to teach them and educate them how to care for their loved one. So they really just have to be willing to listen, learn, and support their loved one. But we don't have very high expectations of our caregivers because that's what we're supposed to do, is teach and educate them.
Okay. That's you as a nurse, that's one of your jobs. Our middle daughter's a nurse. Our granddaughter is she was going to be a physical therapist, and as she finished getting her degree in physical therapy, she decided to want to be a nurse. Now she's a nurse. Mm-hmm. But I've learned over the years that sometimes families expect the provider that's coming in to do everything, and right. I think that what you're explaining is that the hospice nurse does train the family members in ways that they can help provide for the family member, because as you enter the dying phase, certainly the person's dying wants their family member to be close by, and if the family member can't accept that, it's very difficult. Mm-hmm. And I'm sure you've seen that.
Well, every family comes with their own set of challenges that they have within their own family system. But, we're here to support them. And it is hard to lose a loved one. No matter under the best of circumstances, it's hard to lose a loved one. And that's what our job is to support them through that. So...
I think, Kathleen, I've never heard a family say I had a bad experience from hospice. Quite the contrary. Mm-hmm. I've had families say, I don't know what I would have done had the hospice not been there, because they helped me get through this process. Why is it, or how is it, that hospice can be so effective in helping people understand that the person is dying, it's not going to come back, but a hospice team, I guess it's a team approach that you have that does that, because that's what happens. Right.
It is the interdisciplinary team working together, supporting them, and using all of those disciplines to educate the patient and family. It is being able to have that time. We have that luxury of being able to spend time with patients. The sooner they come on our program, the better off we can support, the better we can support families. But it is that being able to sit with that family, explain, support them, guide them, listen to them. When you're in other settings, there's not always the time to have somebody just sit and listen to you. And for most people, it is listening to their concerns, really truly hearing what they need, and then, developing our plan to support them.
Okay. I think something that a lot of viewers might not understand is that almost, if not all, expenses, the medications, the nurses, everything is paid for. Absolutely. And families should not shy away from asking for hospice help because they don't think they can pay for it.
Right.
That's something. How do you? What should our viewers know about?
They should know, again, like we discussed, that Medicare and Medicaid pay for hospice care, insurances, but we are going to provide care for patients regardless of their ability to pay. And we're going to treat the Medicare patient and the patient with no funding exactly the same and providing them the same services. So that's what we're here to do, is to provide that support.
Is there a specific time other than a doctor or a family member saying, this is the time we should talk about end-of-life care? How do you make that decision? That's a question. Every case is different, I guess.
Well, every case is different, but when patients are going back and forth to the hospital, and each time they go to the hospital, you see that they're not getting any better and they continue to get worse. Maybe they've had 5 or 6 hospitalizations within the last year, and every time they go in, you don't see any improvement. You see what we call a functional decline, a patient that may have been up walking and now is not able to walk anymore or is more in the bed. So those are the things that you look at. And that's when you should have that conversation with your physician and say, are we doing the right thing? There comes a point where you have to weigh the benefits of continuing aggressive treatment to, whether or not you'd be better having a focus be on the quality of care.
Okay. I think, is this a difficult situation with cancer patients? That's why hospice developed around caring for cancer patients, didn't it?
In the very beginning, yes.
In the very beginning. Uh-huh. And I guess they saw that, of course, treatments for cancer have changed so much too. But still, it's still probably one of, I guess, our most dangerous of all diseases, cancer. It's not an easy topic to talk about, but I think it's a topic that more Americans need to have a better, if not an understanding, an appreciation that there is help, and there's a time that you need to ask for that help.
Right.
I remember I had command of the Navy retirement home. I think I told you this story. Did I tell you this story? Mm-hmm. Oh, quick, I'll tell it for the viewers because I know they may not see it. I had a guy, 52 years old, and I had just taken command of the hospital, or the Navy home, and his 3 sisters arrived, and 4. One of them was the youngest, and they kept using the paddles to bring the guy back to life. He had had a heart attack. And they came to me and wanted me to talk to the doctors, and I said, I can't do that. So they want, this one did not want the paddles to be continually used. So I went to my priest, and he said, there's always a time to do the right thing. Mm-hmm. And he pointed an example out to me that there's a time for life to end, and we have to recognize that. And that's one of the really strong points of the hospice program is its ability to help a family understand when it's time to let go.
Mm-hmm. I think that is an important part, and having that team support you through that really helps you to do that. There's a movement now where people are talking more. It's called having the conversation, and we've been providing that education throughout the community, and it's a nationwide movement where people really need to begin having conversations with their family. As if you're in that situation where you're faced with end of life, what choices do you want to make? Who do you want to be your healthcare surrogate? At what point do you want to stop aggressive care? And so those are things that people need to be continually having those conversations, but especially if you're faced with a serious illness.
Yeah, good reason for having it is so we don't have any more of the SHABO cases. Mm-hmm. That's something that people need to do. Go on the internet and look it up. But there was one specific thing I'm going to ask you, is a question that came out, and I'm going to have to read this because I don't understand this one. Do you think that the recently approved Medicare payments for end-of-life care discussions between doctors and patients will help expand access to end-of-life support, such as hospice and palliative care.
Mm-hmm.
What? I don't understand that. What is that?
So Medicare has really designed that there can be reimbursement for physicians, whether it's at their office or whether it's any physician, if they choose for one of our physicians to come in, to have what we call goals of care conversation. So it's allowing them the time within their busy schedules to have that discussion. At what point do you want to begin hospice care or supportive care? So it's allowing a physician to separate himself from all of his busy time and to have that conversation with patients and families. Many hospices, including ours, we do have a palliative care program where we can allow physicians to have those conversations with people and really see where they are, what their goals are, and what they want at this point in their life.
I guess I misread it because I was talking about Medicare payments. Are they saying that they're paying the doctors?
Yes.
Medicare's paying doctors to have the end of life?
Yes, conversations. So it is a reimbursement that they're entitled to really
is that being used more
conversation.
widely than it was in the past?
It's not. I don't know that it's really expanded the way that it can, but I think that it has. I think it's allowed more people to have good discussions. I think I have some statistics where it's increased significantly. I guess, let's see. It's really actually helped hospices to grow, and then people using hospice care double.
Okay.
So the average time that a patient spends on hospice is about 2.5 months, and with half the patients admitting, as we said, less than 1 month, this allows doctors and patients and families to have those discussions early in the course of their lives.
So what it's done is caused the doctor to become more involved in
having those goals of care conversations.
That was one of the smart things about the act.
Yes, it was very smart.
I'm not going to ask you your opinion on the Health Care Act. I won't do that, Kathleen. We're out of time, but I want to thank you. I always enjoy talking to you about hospice care. It's a very important thing to me because I think it's something more of our viewers and people need to know more about. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.